Hello everyone, and welcome back to our channel, where we talk all things health, healing, and wellness. I'm Dr. Linh Hoang, and if you or someone you love has been dealing with back pain, stiffness, or reduced mobility, today's topic is going to be especially important for you. We're talking about a condition called spinal bone spurs, or in Vietnamese, gai cot skng. This issue affects millions of people worldwide, especially those over the age of 40. But did you know that younger individuals are developing it too? In this video, we're going to explore what causes spinal bone spurs and why they are becoming more common. 7 powerful healing foods that support recovery and relieve pain. 7 foods you should avoid to protect your spine. Tips for daily use, scientific evidence, and even a few patient stories. And finally, we'll end with a section on caution and moderation, plus what you can do starting today to live with less pain. So grab a drink, sit comfortably, and let's take care of that spine together. What are spinal bone spurs and why they happen? Spinal bone spurs, or osteophytes, are abnormal bony growths that form along the edges of the vertebrae. But here's the surprising part: they don't appear out of nowhere. They are the body's way of trying to stabilize a spine that's been injured, inflamed, or worn down over time. So what causes them? The number one reason is spinal degeneration, especially from conditions like osteoarthritis or degenerative disc disease. When the soft cartilage or spinal discs wear down, bones begin to rub against each other. The body responds by growing extra bone, a sort of reinforcement, but it ends up compressing nerves, narrowing the spinal canal, and causing pain, tingling, stiffness, or even weakness. But why are more people getting them now? Poor posture plays a big role. Think about how often we're bent over phones, slouched in front of computers, or driving long hours. Add to that lack of physical activity, obesity, chronic inflammation from poor diets, and vitamin deficiencies, and we have the perfect recipe for spinal degeneration. Fortunately, there's a lot you can do through nutrition and lifestyle to slow this process, and that's exactly what we'll explore next. Foods that help heal spinal bone spurs. 1. Fatty fish: salmon, mackerel, sardines. Let's start with one of the most powerful natural anti-inflammatories, omega-3 rich fatty fish. These fish are loaded with EPA and DHA, 2 omega-3 fatty acids proven in studies, including one published in the Journal of Pain, to reduce joint and spinal inflammation and even help manage nerve pain. They help keep your spinal discs flexible, reduce stiffness, and support nerve function. Try eating grilled salmon 23 times per week. If you're plant-based, algae oil or ground flaxseed can be a good substitute. A patient of mine, 64 years old, began eating sardines twice a week along with turmeric tea. Within 2 months, she reported less lower back stiffness and better sleep. Dark leafy greens: spinach, kale, collard greens. These greens are rich in calcium, magnesium, and vitamin K, all essential for bone strength. Antioxidants like lutein and zeaxanthin help protect spinal tissue from oxidative stress and slow degeneration. You can saute spinach with garlic or blend kale into smoothies. Try pairing with lemon juice for better calcium absorption. A study in the American Journal of Clinical Nutrition found that diets high in leafy greens are associated with lower rates of bone loss in postmenopausal women, a high-risk group. For spinal issues, vitamin-rich fruits: oranges, kiwis, strawberries, guava. Vitamin C is vital for collagen production, which keeps your discs and joints healthy and flexible. These fruits also have natural anti-inflammatory benefits and support the immune system. Aim for 1 to 2 servings daily. Guava is an excellent choice. It has 4 times more vitamin C than an orange. One patient began eating half a guava each morning. Within weeks, her morning stiffness reduced noticeably without any change in medication. 4. Soy and soy products: tofu, soy milk. Soy contains isoflavones, plant compounds shown in the Journal of Bone and Mineral Research, to help preserve bone density and reduce inflammation. Soy is also gentle on the kidneys, unlike red meat. Enjoy tofu stir-fried with turmeric or soy milk with oatmeal. For postmenopausal women, soy can be especially beneficial in reducing spinal thinning. 5. Turmeric and ginger. Both are ancient anti-inflammatories backed by modern science. Curcumin, the active compound in turmeric, has been found in studies like the one published in Phytotherapy Research to rival ibuprofen in pain reduction, but without side effects. Ginger improves circulation and reduces stiffness. Try making turmeric ginger tea with a bit of honey and black pepper, or use in soups and stews. I had a patient drink turmeric tea before bed each night. She called it her liquid gold and reported fewer flare-ups over time. 6. Chia seeds, flax seeds, walnuts. These are rich in plant-based omega-3, which reduces systemic inflammation and nourishes the joints and spine. Flax seeds also contain lignans, which help balance hormones and support bone density. Add 1 tablespoon of ground flaxseed to smoothies. Sprinkle chia seeds over yogurt, or snack on walnuts. 7. Eggs and low-fat dairy. Eggs contain vitamin D, choline, and protein, while dairy offers calcium together. They support strong bones and proper nerve signaling. Choose hard-boiled eggs, low-fat yogurt, or unsweetened calcium-fortified soy milk if you're lactose intolerant. Pro tip: combine dairy with vitamin C-rich fruit to improve calcium absorption naturally. Top healing food spotlight: turmeric. If I had to choose one superstar, it's turmeric. Not only is it anti-inflammatory, but it actively supports nerve healing and pain reduction at the molecular level. Its combination with black pepper increases absorption by 2,000%. Take 12 grams daily in food or tea, but always with a fat source like milk or olive oil to aid absorption. Foods that worsen bone spurs. Let's talk now about the foods that make things worse often quietly. Red meat and organ meats, high in purines and saturated fat, which raise inflammation and may accelerate spinal wear. Fried and fast foods promote weight gain and systemic inflammation. Just 5 extra kilos can put significant pressure on your lower spine. Refined sugar and sugary drinks disrupt calcium absorption and lead to chronic inflammation. Alcohol and strong coffee affect calcium metabolism and reduce bone density over time. Salty and processed foods can cause calcium to be lost through urine. Instant noodles, canned soup, and processed snacks are top culprits. Oxalic acidic foods, watercress, green tomatoes, and morning glory are healthy in moderation, but can inhibit calcium absorption in excess. Fermented and preserved foods, fish sauce, pickled vegetables, and fermented tofu can contribute to toxic buildup in sensitive individuals and worsen inflammation. Caution and moderation. Even good foods can backfire if used the wrong way. Bananas are nutritious, but overripe ones are high in sugar and can spike inflammation if eaten excessively. Cow's milk provides calcium, but may not suit those with dairy sensitivity. Try yogurt or plant-based milk instead. Grapefruit is rich in antioxidants, but can interfere with certain medications. Always consult your doctor. Balance is key. No food is magical on its own, but together with daily movement and healthy habits, you can create lasting relief. There you have it, a complete guide to understanding, managing, and healing spinal bone spurs naturally through food and lifestyle. You now know what causes spinal bone spurs and how to prevent them. The 7 most healing foods to support your spine. The 7 worst foods to avoid if you want real relief. How to use these foods every day in simple, powerful ways. If you found value in this video, please like this video to support the channel. Subscribe so you don't miss future health tips, and share this video with someone who needs it. If you have questions or want to share your healing journey, drop a comment below. I personally read them all. I'm Dr. Linh Hoang, reminding you that healing starts in your kitchen and your daily habits. Stay kind to your body, move gently, eat wisely, and your spine will thank you. See you in the next episode. 5 daily exercises that strengthen your spine and relieve pain naturally. Take care and be well.